Hello everyone. This presentation is on Si Shen Wan, also called for Miracle Pill. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Si Shen Wan is classified under stabilize and bind. A representative pattern is spleen and kidney yang deficiency causing early morning diarrhea and abdominal cold. Important ingredients include Budu Jai, Wu Ju Yu, Rudu Ku, Wu Wai Zai, Shen Jiang, Da Zao. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 65-year-old man with chronic diarrhea and hyperlipidemia. The current medicines are atorvastatin, trazodone, lisinopril. This case gives a plausible reason to consider Si Shen Wan, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Budu Jai plus hepatotoxic medicines. The mechanism is Soralia has been associated with liver injury in case reports and pharmacovigilance data. The clinical significance is potentially serious with statins or pre-existing liver disease. My management plan is avoid if liver tests are abnormal and stop for jaundice, dark urine, or severe fatigue. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Wu Ju Yu plus CYP substrates. The mechanism is Evodia constituents can affect drug metabolizing enzymes and transporters. The clinical significance is uncertain but potentially relevant. My management plan is use medication review when narrow therapeutic index drugs are present. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Ruduku plus sedatives. The mechanism is nutmeg at excessive doses can cause CNS effects. Sedatives could increase impairment. The clinical significance is low at proper formula doses, but serious if abused. My management plan is avoid self-escalation and monitor sedation with trazodone or similar drugs. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Si Shen Wan may be reasonable when the patient's presentation matches spleen and kidney yang deficiency causing early morning diarrhea and abdominal cold. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula list, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.